So many people think blood sugar problems only come from eating too much sugar. But in clinical practice, I see a lot of patients who are doing the best with their diet, doing the best, and still have unstable glucose levels. That tells us that there is something deeper that is happening in the body. So we're going to break this down. We're going to talk about insulin resistance first. This is when your body cell stops responding properly to insulin. So the glucose stays in the bloodstream instead of entering the cells for energy. This leads to elevated blood sugar over time. And you will hear me use blood sugar and glucose interchangeably, they mean the same thing. The second reason could be hidden carbohydrates. It is not just your candy or soda that we drink here and there. Things like bread, pasta, flavored drinks, and even healthy packaged foods can contain hidden sugars. These all contribute to frequent glucose spikes. Another reason is chronic stress. If you have been following my videos, you realize that stress play a major role in a lot of these medical conditions that we've been talking about. When the body is under stress, it releases cortisol and adrenaline, and I've mentioned this over and over again in my previous videos. This cortisol and adrenaline are hormones that increases blood sugar, and it prepares the body for fight or flight. When stress becomes chronic, like it's not just a 1 day or 2 day stress, everyday stress, when it becomes chronic, your blood sugar stays elevated. Another reason is poor sleep. We've also talked about this over and over again. Poor sleep increases insulin resistance and disrupts glucose regulation. Even a few nights of poor sleep can increase blood sugar readings. Next is your medications. Certain medications can raise your blood sugar levels. This includes the steroids, some psychiatric medications, and certain blood pressure medications. This is why medication review is important when the diabetes is uncontrolled. So we're not just looking at the sugars alone, we're looking at other factors. Let's talk about the liver and metabolic dysfunction. The liver plays a major role in glucose regulation. When metabolic function is impaired, the body may release too much glucose into the bloodstream. This contributes to persistent elevation even without dietary triggers. Now, when we put all these puzzles together, we realize that this blood sugar imbalance is rarely caused by one thing. It is usually a combination of insulin resistance, stress, medications, not sleeping well, and metabolic health. So, when we identify the root cause, we can better control our blood sugar for a long term. Which of these factors do you think have been affecting your blood sugar or affecting you the most? You can comment below. Thank you.